Hi, I'm Jenny Barker, naturopath and health educator. Have you been diagnosed with irritable bowel syndrome or IBS? Today I just wanted to have a talk to you about some of the causes of irritable bowel syndrome and what you can do if you have irritable bowel syndrome. Because often you've been diagnosed by your doctor or a specialist, and many people think that there is nothing that can be done to help with irritable bowel syndrome, that it's a condition that you just have to put up with. So what is irritable bowel syndrome? So irritable bowel syndrome is where you get a group of symptoms, and these symptoms come from reactions that happen in your large intestine, and normally they've been happening for a period of longer than 6 months, so they are long term. And so you might get symptoms such as bloating, you might get gas, constipation, diarrhea, or both, alternating constipation and diarrhea. You might get abdominal pain and cramping. You might get urgency in terms of needing to get to the toilet very quickly. You might have, might use your bowels 3 times or more in a day. So there's a number of symptoms that can be diagnosed as irritable bowel syndrome. And what often happens is that the doctors or specialists diagnose this condition as an exclusion, as in they don't know what it is. They know that it's not Crohn's, that it's not that it's not inflammatory bowel disease, or it's not celiac disease. So often it's just a group of symptoms that relate to your digestive system and they don't know what it is, so they say you've got IBS. But please don't think that there is nothing that can be done about it, because there are many things that can be done to help reduce or even get rid of all of your symptoms that you can get with IBS or irritable bowel syndrome. So as a naturopath here in clinic, I see lots of people that have irritable bowel syndrome or have been diagnosed with it, but I always take things back to the basics. So I'm always looking at what could be causing it. So addressing things such as, what are you eating? Are there food intolerances or food sensitivities there? Have you got the right nutrients that you need to digest your food properly? Is there stress playing a role in this? So, our stress response relates to our nervous system, which can make our bowels overreactive. Or is there some sort of hormone issue happening? And so, looking at these basics is really important, but then there can be other things that can be going on. So things such as, that might create a poor gut environment or poor gut health. And so these can be things like dysbiosis, which is where you have an imbalance of the good and bad bacteria or fungi or viruses in the intestines. And this can come from a number of causes. You can get an infection, or it could be from some medication that you're on, or antibiotics, stress, poor digestion. There's lots of things that can cause dysbiosis to happen. It can cause inflammation in your gut, and then this can start to cause all these reactions or symptoms that you start to get. So I recommend that you work on addressing these causes and, working out the food intolerances and the nutrient deficiencies are the basics that you need to do. If you need help, you can go to a naturopath and they can help you with these, so that things can be really specific for your symptoms in your case, because everyone is different. But if you do think you have irritable bowel syndrome and you have addressed those basics first, then you may need to go to a naturopath who can do further testing for you. So things like comprehensive stool tests or other gut related tests. And if the symptoms have not disappeared after their basics have been addressed, then I would recommend that you do this. So if you think you have irritable bowel syndrome, there is something that can be done about it. Please don't just think that there is nothing that can be done and that you have to live like this forever, because it can cause other things to happen in your body, such as malabsorption of your nutrients, and then those nutrients that are needed for so many different processes in your body can start to cause other things to not work so well. So for example, if you can't absorb zinc's involved in over 200 processes in your body, and so it's very important for your immune system, for your digestive system, for your hormones, for your skin, for your brain chemicals. And that's just one of the minerals, but we've got lots of minerals and vitamins that we get from our food and through supplementation that we need to be able to absorb these properly so that everything can function in our body. Otherwise, you might start to develop further issues, and particularly as you get older. So I hope you found this helpful. I will see you next time. All right, bye for now.